Hi, Dr. Levitt. Thank you for joining us today. Greatly appreciate your time. And just for the audience that's watching this around the world, tell us a little bit about who you are and what you do.
Yes, thank you. So happy for this invitation. My name is Marc Levitt. I'm a pediatric surgeon with a specialty in colorectal surgery of children. I'm the chief of the Division of Colorectal and Pelvic Reconstruction in Washington, D.C., Children's National Hospital. And I'm excited to be here. Thank you for the invite.
No, excited to have you. And, and tell us a little bit about your experience in TeleView and how you've been using that platform.
So a little bit of history. I have been very involved in educating surgeons in techniques in pediatric colorectal surgery for the last 25 years. It's a challenge. I have to often travel forth to the world and help them with their cases. There are some unique techniques, advances in techniques that particularly in the developing world need the skill set to help more children. I have had surgeons come to me and scrub with me here. However, that's often limited by the credentialing process. And they can observe, but they can't actually perform as an assisting role in the operating room. So when TeleView approached me as a way to mentor surgeons remotely, I was really excited because I really felt that I could dramatically, exponentially expand my reach and stay in my office while I was doing it.
That's incredible. and give us a case study of how TeleView has helped you do that recently, and what that's meant for the patients and in the areas around the world where you've done that.
Yeah, so I have been linked up with a mentee. My role is the mentor of a surgeon who works out of Johannesburg, South Africa. And we schedule cases together. The time zone is a bit of a challenge because it's early morning for me and mid-afternoon for them. So we join. The technology is super cool. I log in on a regular old website, and they initiate a call to me through a QR code. I'm told there's a picture of me in the operating room with a QR code I'm holding up as a sign, and they just need to look at the QR code, and my app rings. I answer, and I can see the surgeon's view. I can talk to the surgeon. I can animate the field. I can zoom in, zoom out to improve my view. I can show a slide. I can share my screen and say, nope, take a look at this diagram before we progress. Just last week, they did a case that had never been done before in South Africa. It was a posterior rectal wall mobilization for a child with an anorectal malformation. And the great advance was we now can avoid dissection of the the front rectal wall, which really minimizes complications. The operation was much shorter than the prior technique. There were 8 or 9 surgeons in the room watching, and we really impacted the care of that child, of that surgeon, of all the future children that patient, that surgeon will care for, and all the members of the team that got to watch a new technique. I felt very comfortable. I was right there in the operating room. We were chatting, we were joking around, we were talking about the anatomy together. If there were pauses in the operation, which tend to occur when instruments are needed to be gotten, et cetera, I could check an email here or there. It was very comfortable, very pleasant. I mean, I just couldn't believe it. The alternative would have been for me to physically be present, scrubbed in that operating room, across the world.
And just out of curiosity, what was the outcome for the patient? How did that go, 30 days post-surgery?
Went extremely well. The child, because of this technique, was able to eat the same day and go home the next day. So their post-operative course was minimized. They have proper anatomy now. So when they grow up, it was just a baby. When they grow up in a few years, anticipate to have normal bowel control.
Incredible. And in terms of you having to learn the platform, that's one of the things that we always see is that some of the platforms that physicians are asked to use are requiring them to spend 30 to 60 to 100 hours to learn how to use them. And they have technical issues, they have experiential issues. Give us an idea of, first of all, how long did it take for you to learn how to use it? And have there been any kind of technical issues that you've encountered while using it?
Actually, that was super easy. It's very user friendly. You hover over the various buttons and it tells you exactly what they do. If I want to zoom in, et cetera, if I want to annotate, it's very user friendly. I had, I think, 2 tutorials that lasted maybe 10, 15 minutes. The company representatives were very, very helpful. They were very accessible. I actually had forgotten how to zoom in, and I was in direct chat communication with them during this last case, and in 2 seconds found the correct button. I think the main limitation, to be honest, is the time zone issue. So I think mentoring probably needs to be north to south rather than east to west, just from that particular practicality. We're a little bit limited by Wi-Fi. At times the image froze briefly, and on that side of the world, the Wi-Fi was not as good in the operating room. I think that's an easy enhancement. That was one deficiency. I think the image could be a little bit crisper. It has a little bit of a fuzz to it. I mean, it's not as, I'm not right there in the operating room, but I was able to see well enough to advise. And I think that's just a matter of continuing to improve the input and the output. Of course, we're crossing, thousands of miles, and I understand there are limitations. I will say that the surgery I mentor is open surgery, so that you actually have to see the body part, as opposed to a laparoscopic surgery or an endoscopic surgery where the image is on a screen conveyed through a fiber optic cable of a telescope. Those images are much clearer, very clean, because you don't have that distance between the eye and the location that you want to look into the body, and there's not a focal length problem. But that's the kind of surgery I do, so I think I need a little bit different of a visual capacity.
Tremendous testimonials. I really appreciate the detail as well. And from an economic standpoint, is this kind of like a pro bono thing? Is this you helping patients around the world, or is there an economic model here where your institution is actually there's some sort of economic benefit to this platform?
Oh, 100%. I can see this mechanized, monetized in a great way. Of course, this is pro bono, and I'm helping a colleague and improving the care in the developing world, which is a big passion of mine. We do this through our organization. It's called Colorectal Team Overseas, quite routinely, with travel to and helping of mentoring of surgeons and nurses. However, there are certainly places in the world that would benefit for the mentoring, and I'm sure would be happy to pay for that mentoring. And I'm currently mentoring 4 institutions in the United States that are trying to build up a pediatric colorectal program. The current offering to those institutions is on-site training of that surgeon here and me there, and Zoom calls to talk through cases. I could easily see adding this TeleVU option to that offering to join those surgeons for their cases. I can tell you they would be thrilled and probably very excited to sign up for it. And I would be thrilled because I don't have to travel, and yet I can help them with their complex cases. Usually these surgeons are very capable and just need a little bit of guidance. They just need someone on their shoulder talking them through the case as in a collaborative way. In the apprenticeship model, the traditional surgical training model is an apprenticeship where a senior surgeon is teaching a junior surgeon or a trainee. This is the same thing. They have the skill set. They just need a little bit of encouragement, a little bit of recommendation of what needs to be done at that particular moment, and the confidence that someone who has seen it before is standing right there on their shoulder, through their eyes and ears.
That makes a ton of sense. And again, it just sounds like a truly revolutionary technology that can help patients around the world. And it sounds like it's easy to use, easy to learn, and has an economic model to it that'll be sustainable. So
I would also
all
say,
around.
I'm sorry to interrupt. I would also say, not just in the operating room, this could be used. I mean, what if I needed to join them in their clinic and wanted to see the patient's abdominal exam or the x-ray that they were reviewing with that particular patient? What if a paramedic in the field were wearing these glasses and the ER doctor who was expecting that patient from the car accident scene to arrive and could start guiding care before they reach the ER? It's truly exponential what we could do with this kind of thing, kind of technology.
Phenomenal. Well, thank you very much, Dr. Levitt, for joining us today. Really appreciate your time, knowing how busy you are. And again, good luck to everything you're doing, and have a terrific day. Take care.
Really appreciate the invite. Good luck.